Morning. Today we're going to talk about what compression is and what types of compression we should be looking at. So why choose compression? We usually look at compression for some oedema in the lower legs. It aids in the healing of venous leg ulcers, also in venous insufficiency, and prevents the recurrence of venous leg ulcers. Step 1, you need to do a full holistic assessment. This is usually carried out by your nurse specialist or maybe your consultant in vascular. You then select the compression garment, stockings or bandaging system. This is all done by a skilled person when you're looking at the measuring of the type of compression that you need. So you're looking at the size, the type, and then you document it. The most effective compression is high compression. So when we talk about high compression, we talk about 40 millimoles of mercury of a bandage or a stocking that can provide this. And also you look at what the patient can tolerate. So these are the type of compression bandages that we would have on in some of our areas. So you're looking at Pro4, Coban and Actico. These are just samples of a couple. Compression stockings, then you would have different classes in your compression stockings. So you have class 3, 2 and 1. 3 is the high millimoles of mercury, class 2 at a minimum, and then class 1 you have for mild symptoms. Some you may have the manufacturer's types. You have European standard or British standard. European standard is stronger and it is more effective for oedema. These are just a sample of a couple of the compression hosiery that we would have in contract here. And also you can see from the Activa brand, it actually says class 2. That will always be documented. When you're choosing the compression, you look at the colour for the client, what they would like, open or closed toe. If oedema is present, it always, especially in the toes, it's better to get a closed toe. And then you give them instructions then on the care of the hosiery. It's always good to have 2 pairs at any one time. When you go to measure for hosiery, compression hosiery, it's always good to do it early in the morning when the oedema is at its minimum, or when straight away you take off the bandaging system. You look for the narrowest part of the ankle, the widest part of the calf or the leg, and then sometimes you will need the length. It's always good to get the client to weight bear as well. Thank you. And then to check for the garment and the stocking fit. Is the client able to put it on? Take it off. There are many aids in how to do this. These are just 2 samples of aids that can help to put on stockings. Easy Slide and ActiGlide. These can be bought. Finally, education to the client on their skincare, on their ankle and calf exercises. And then if you have some patient education leaflets, absolutely give them to them. And here we have a couple of samples of education leaflets. And this is just an example of ankle and calf exercises. A question that has been posed to me a few times is, can I leave my stockings on for a couple of days? My carer doesn't come in or my family. Really, at a minimum, the stockings should be removed twice a week, just to inspect the skin underneath, to wash and do the skincare. Thank you. Have a good day.